The healthcare industry in America leaves so much to be desired. Medical debt is increasing, billions are lost in unpaid claims, hospitals are in the red, service prices can range up to 30x. But that's not all.
Nobody knows the price of healthcare. When we say nobody, we mean nobody.
It's unaffordable, opaque, and it's becoming a leading category for viral memes as a result.
Around 50% of every dollar that is being invoiced is being uncollected. That's unheard of.
Healthcare, broadly known and understood to be among the worst consumer purchasing experiences.
We have definitely talked to some clinics where if they don't get paid 1 month, they literally can't make payroll.
What is actually being unwound is the backbone of healthcare for a very large portion of the country. And so I think it's going to just blindside and surprise a ton of people.
As part of this short 6-video series on the emerging intersection between healthcare and fintech, we talked to the founders trying to modernize the $4 trillion healthcare industry, together with the help of fintech. As a reminder, the content here is for informational purposes only. Should not be taken as legal, business, tax, or investment advice, or be used to evaluate any investment or security, and is not directed at any investors or potential investors in any A16Z fund. For more details, please see a16z.com/disclosures. A significant portion of the United States population requires ongoing care for chronic conditions. In fact, according to the CDC, approximately 6 in 10 adults in the United States have a chronic disease, and 4 in 10 have 2 or more chronic conditions. Additionally, older adults and individuals with disabilities often require recurring healthcare services to maintain their health and wellness. Recurrent care clinics help these individuals and address everything from mental health to neurodiversity support to physical therapy. But unfortunately, such clinics run into a host of challenges. Patient eligibility, claim denials, transparency in insurance coverage, or lack thereof, and patient data sharing can all hinder the coordination and continuity of care. But also, there is a very real problem in these clinics making payroll. Here is Jade Chan, CTO of Juniper, a company simplifying revenue cycle management for recurring healthcare clinics. Here, Jade reaffirms how misaligned incentives between patients, payers, and providers have resulted in an extremely complex healthcare payment system.
I think the more I've sort of learned about healthcare, the more I'm really starting to see that a lot of issues stem from misaligned incentives in healthcare. And I think that is a lot of what drives the most pressing issues in healthcare and fintech today. There is sort of this natural relationship between patients, providers, and payers. And I think they're all sort of not aligned to succeed together sort of in the current setup. Like, patients find it hard to get care. It's hard to understand your own insurance coverage. It's hard to get insurance coverage. You can not be incentivized to get care early, could potentially lead to unchecked issues, sort of ultimately higher costs for everybody in the system. Providers find it hard to get paid for their services, right? There's a lot of nuance and detail in the process of submitting, tracking, triaging claims. And payers are sort of naturally incentivized to create cost structures that are difficult to navigate, and sort of also leading to higher costs for everybody in the system.
This misalignment generates all sorts of externalities, including a serious pain point for recurrent care clinics, as they struggle to get paid for the services that they're providing. Recurrent care clinics address everything from mental health to neurodiversity support to physical therapy. And one example of this is within autism clinics, and the opportunity to build for this niche is actually what inspired the creation of Juniper.
Yeah, I think there's a growing field in recurrent care, right? Like, I think mental health, things like, it's just sort of become increasingly popular. Juniper is actually sort of currently really focused in the autism space within recurrent care. We do want to expand into other areas, but right now most of our customers are sort of autism clinicians and providers. And we did choose that sort of pretty intentionally. One, I think it is a canonical example of recurrent care, right? Patients who receive care, like receive very sort of the same session over and over at high frequency. And also too, it's actually where we thought we could have one of the biggest sort of impact. There has been a lot of legislative passing around the 2008 mark. I think Medicaid started covering a lot of these services for autism, and a lot more people and children were being diagnosed with autism. That means more people are aware and can get care. But the number of clinics haven't actually necessarily scaled with that. And so our focus is like a pretty big mismatch between patients who need care and the care available in the United States.
And with this increasing attention, recurrent care clinics, like autism clinics, are trying to scale. But to offer more services, these clinics need to ensure that they're actually getting paid.
Right now, we're sort of really focused on helping clinics get paid for their services. That in turn, I think, helps clinics offer care to more patients. And then it also helps ensure that there can be more clinics and that the clinics can grow. We have definitely talked to some clinics where if they don't get paid 1 month, they like literally can't make payroll. There's like sort of very real concerns that go into revenue cycle management for a clinic. And on paper, you know, they might be billing a lot that month, but if their claims are delayed for X number of days, they literally struggle to make it week through week. And so I think we are sort of focusing on the clinic right now, helping them get paid for their services, and then by also then helping them offer more care for the patients.
While Juniper is focusing on automating the billing process for these clinics, that is only one part of the problem. Clinics are also burdened with the administrative processes that are unnecessarily complex and reduce the time spent with patients, another problem that Juniper hopes to solve one day.
I kind of see Juniper as like a one-stop shop for recurrent healthcare for sort of clinics and patients. So like on the clinic side, like you're like, I want to start a clinic. Juniper can help you with, you know, registering your NPI numbers. It can help you with like setting up all of your stuff to make sure that it's best practice, that it's sustainable, sort of use the knowledge that we've accumulated to help you get set up for success. And then sort of you can then use Juniper, you know, as the platform to manage your sort of scheduling, you know, your data, and as a billing platform, and sort of all of that is there. For the patient, which we haven't even necessarily explored yet.
So what do you think? Can we rebuild this broken system? Where do you see the biggest opportunities for disruption in healthcare? Let us know in the comments below. And if you like this video, be sure to check out our next installment with Headway, a company trying to solve for the 1 in 4 Americans with a treatable mental health condition, like depression, anxiety, or PTSD, yet most of these individuals cannot access care. And if you'd like to learn more about how fintech is revolutionizing healthcare, head on over to a16z.com/healthcare-meets-fintech, or click on the link in our pinned comment. Thanks for listening to the A16Z podcast. If you like this episode, don't forget to subscribe here on YouTube to get our exclusive video content. We'll see you next time.